Welcome back to Breakfast Daily on City TV. Don't forget to send us a message and let us know your thoughts on what we're discussing on the show today. You can hashtag Breakfast Daily and you can send a WhatsApp message to 0550-585832. And we'll pick up your messages and hopefully we'll be able to read them on the show. Now, health concerns. We all need to be very vigilant about what's going on around us with regard to health. Now, there are a few health concerns that have propped up in the past couple of years. Obviously, we all know about COVID. We heard recently about the influenza strain that swept through the Hearts of Oak camp and is also a major health concern. And now we're hearing about monkeypox. Initially, we were told that this was an outbreak happening in Europe, but Ghana has recorded at least 5 cases from what we are told. Let's take a look at this report.
Monkeypox is a zoonotic disease caused by the monkeypox virus and transmitted from an infected animal such as squirrel, rats, dormice, and monkeys, or from an infected person. It could also spread through objects used by an infected person. According to the Ghana Health Service, 5 cases have currently been recorded in the country.
Tested 12 suspected cases in Ghana since 24th of May. Currently, we have confirmed 5 cases in 3 regions, Eastern, Western, and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded in a Ghanaian who traveled to the United States from Ghana. So I picked it from here. It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how it went. And then, of course, then the rash and the blisters will appear. That's how monkeypox is. That doesn't mean that every rash is monkeypox. There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so, especially the West African one, is mild.
All right. Now, if you were to go to citynewsroom.com, we also have it captured here. The Ghana Health Service says 5 cases of monkeypox disease have been recorded in Ghana since the 24th of May. They detected 12 suspected cases, reiterating that the cases were in 3 regions, Eastern, Western, and Greater Accra. And Dr. Patrick Kumar-Boaji has been speaking extensively about this. He did say that one of the cases was a Ghanaian who traveled from the United States to Ghana, so it might have been picked up from there. And then also symptoms of the disease include fever and rash, but the infection is usually mild. Now, we'll be taking a look at some more from the press conference held by the minister, but the Director General. But let's say good morning to Duke Mensah Opoku, who's our parliamentary correspondent and colleague here at City. Good morning, Duke.
Hello.
Hello. Hello. I like the energy in your hello.
I missed the set. I've been off for 2 weeks.
The set welcomes you.
Oh, yeah.
The set likes you.
Yeah.
Duke. But it's good to have you on.
Yeah, good to be here.
Charlie, in addition to everything else we have to think about these days, monkeypox.
Yeah.
COVID obviously has been with us for a while, and now this new influenza strain. But monkeypox, I mean, manifests in the skin. But we were thinking it was our European cousins who were dealing with it, and now
it's here.
It's here. It's here, unfortunately.
Very unfortunate. I mean, the kind of thing it does to the skin, so unpleasant if you look at it. Yeah. And thankfully, the spread is not that wild. That's the good thing about it. Not so good thing, but so it means that if you take very good care of yourself, you may not, get infected. So globally, there are not even up to 1,500 cases. That should tell you how the spread is slow. But because of everything associated with it, it's a public health concern. So we all need to be on the guard. We all need to be on the lookout. We all need to ensure that nobody gets infected by this. Because if not for anything at all, even if you get it and you get it treated, look at what it does to your skin.
Yeah, the scars of it.
Yes, it does to your skin. So we may leave its footprint, its legacy on your skin for probably the rest of your life. So we all need to be very, 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 very careful. Maybe our video did not bring those portions, but I think it's important for the health authorities to stress on how the mode of transmission.
Yes.
So that people
Yes.
can protect themselves.
The they talked about, between
contact.
humans and animals, contact
Yes.
with certain animals makes you more prone to
Yes.
contracting it. But let's take another look at what was said additionally in the presser, especially with regard to the three main kind of things that have been introduced into our society as far as health concerns: the COVID, influenza strain, and monkeypox. Let's take a look.
Of late, there have been a series of events of health that we need to use this opportunity to clarify and give you an update on what is happening as far as the COVID is concerned. We'll give you the update on COVID situation. As you're all aware, there has been a surge in the last few weeks. Vaccination, exercise, and activity that's going on for COVID. We'll give an update on influenza A3, I'm sure, H3N2, that is out there, which was accidentally christened as Hans virus. We'll explain that to you. And then the situation of monkeypox in the country. Generally, we have seen a rise in the cases over the past few weeks. Currently, we have about 400 active cases. If you look at a situation where we had probably less than 20 at this stage in the last few weeks, that is an increase. But this is largely an Accra phenomenon. I would even say it's Greater Accra. It's an Accra surge, mainly, not Greater Accra, and we'll explain all that to you. The sporadic outbreaks are related to events including schools, outbreaks, and work-related outbreaks. So it's in the schools and mainly in the workplace. But of course, we all close from work and go home. We all close from school and go home. And so now it goes into the community. We are seeing very low positivity at the airport lately. And the Omicron virus variant remains the most dominant still. And then currently the uptake of vaccination has also significantly come down. And I think it's an important wake-up call. Generally, we have recorded about 162,000 cases. We have done more than 2.4 plus million tests. About 160 of the 162,000 have recovered. Unfortunately, we've lost about 1,445 cases, and we have not lost any person to COVID since early March. The active cases as of the 6th of June is 452. So you can see there's a real hike. It drops and it goes up based on the number of cases that is coming in. Currently, there's no severe or critical case, and we are very thankful for that because that is also an indication that the vaccine is protecting us. The next slide just is the general trend to show the various 4 waves that we've had so far. And then you can see towards the end there's a little hump that is rising as a result of the current upsurge. And obviously, we can see that the protocols are significantly down, so our protection is quite low. Now, let me also show with you where these 400 active cases really are. The majority are not in Greater Accra, in Accra. As you can see from the chart in the red spots, their downs and areas are quite, and we have about 4 cases in Eastern region, which is 3 in New Jabin North and 1 in New Jabin South. We have 3 cases in Takoradi, Sekeni Takoradi, and Wasa Amenfi is 1. So all the other active cases are in Accra. And if you look at the chart there, you can see that the red zone still remain. Accra is the main hotspot. In fact, actually deep red in some aspects. And then other parts in the north, apart from Upper East, the rest is quite, the prevalence is low, or the cases reported. So now, let's take you through what has gone on in Accra. As I said earlier, there's been a gradual surge in the number of cases, across the Greater Accra region over the last 1 month. In January, when we had a very high peak, we recorded 4,888 cases. In February, with an average number of about almost 150 cases per day in Greater Accra, it dropped to 2,523 in February with an average of 84 a day. Then it dropped to March of about 5 a day, 152, 5 a day. In April, dropped further to 1.3 cases a day. That's about 39 cases in the whole of April. In May, that's last month, it went up to 399 cases. And June already, as at the 8th of June, we have recorded about 268. I would say this about us at 7th or so, or 6th. As at the 6th of June, we have already recorded nearly the same number, 267 cases. So you can see that there's a gradual increase in the cases in the Accra Metro and its immediate environs. So as I said, currently, of the Accra cases, about 18%, 18.1% of the outbreaks are among children aged between 0 and 15. Obviously, these are unvaccinated children. So that count 18% of this number are in children. I think the next.
So that was Dr. Patrick Kumar-Boaji, the Director General of the Ghana Health Service, just giving us a breakdown of what the numbers are looking like with regard to COVID-19 and the information about the influenza strain that has also found its way into the system, and monkeypox as well, the third issue that is making a lot of waves currently. I'm still here with Duke Mensah-Opoku. We'll be discussing this a bit more, but we also want to talk about the reaction from the medical community. So the Ghana Medical Association has also issued a statement about this. Intensify COVID-19 vaccination again, GMA urges, amidst surge in cases. And this article is on citynewsroom.com if you want to read more. So the Ghana Medical Association has urged government to reignite and intensify education on vaccination against COVID-19. The comment follows a revelation by the Ghana Health Service indicating that COVID-19 cases are on the rise again. Currently, over 300 active cases are being handled by health authorities. And as we heard from Dr. Kumar-Boaji, I think that number is in the 400s now. The General Secretary of the Ghana Medical Association, Dr. Titus Beyo, said the public should be encouraged to get vaccinated. Quote, there must be educational campaigns as the cases begin to rise to get people to volunteer to take the vaccines. At least people have received the vaccines for well over a year and nothing has happened to them. That should give enough confidence to be vaccinated now. He was speaking on Eyewitness News. The Ghana Health Service is worried efforts at containing the spread of COVID are being frustrated by the unwillingness of most Ghanaians to get vaccinated. Again, the Director of Public Health at the Ghana Health Service, Dr. Franklin Esidu Bequin, said COVID-19 cases have risen over the last 2 weeks, and this is a sign that the virus still persists. He's urging Ghanaians not to let down their guard. Now, in addition to talking about the 300 cases of COVID, we also have flu, the H3N2 variant going around. So a number of people are coughing and sneezing. Most of the test results come out as either H3N2 or COVID-19. He indicated that most of the cases are recorded in the Greater Accra region. Some were recorded in schools, and others were traced to parties and indoor events. Health experts cannot predict if the virus will ever be a thing of the past. That is why we're trying to integrate it into our healthcare and pushing for more vaccinations. He also indicated that less than 10% of Ghanaians have been vaccinated. Again, you can read more on citynewsroom.com. So Duke, here's the medical community also speaking out to buttress what we're being told and to encourage those who have not yet been vaccinated to go and do so. Now, we've seen a relaxing of the protocols, right? We know that now mask wearing is not mandatory, although some churches are still, requiring that you wear your mask when you come. But for the most part, that has gone out of the window. We're not seeing people washing their hands as much as they used to. Before you enter a public space, banks, etc., there was always that poly tank or receptacle of water where you could wash your hands. the hand sanitizer, all of those things seem to have taken a back seat, you know. But it looks like perhaps we need to ramp up again with the protocols.
Actually, everybody's guard is down.
Everybody.
I must say, everybody's guard is down in relation to COVID. I mean, because here we were thinking that it was gone. It was gone because with the relaxation in the protocols, everybody interpreted that to mean that that phase of our lives was over. But now with the numbers going up, it would have been interesting for the health service to break that down for us to know if the people who are the active cases, some of them are vaccinated or all of them are unvaccinated. To, as a matter of fact, get to demonstrate the utility or the importance of the vaccination. Because at this point, I think I got a text message, I think 2 weeks ago or so, from the Okankwe Municipal Health Directorate, because that's where I took my shot at Achimota, the La Paz Community Hospital in Achimota. That's where I took my shot. And there was a message to the effect that booster shots are now available. So I can come for a booster.
You can go and get a booster.
Yes, if I can read that message quickly.
That would be good.
That so this is, okay, so Okankwe Municipal Health Directorate. So it says Okankwe Health Municipal, Achimota, Abeka Akweteman is still conducting a COVID-19 vaccination exercise. Visit our sites for your first, second, or booster dose now. This is Thursday, June 2nd, 6:24 p.m. So that's when, which should tell you that they still have my number in their database. So that's some good work that they are actually doing. And yesterday I had about 2 or 3 of my colleagues in the parliamentary press corps go for a booster shot. And Parliament has been running the booster shot program for, I think, since January. So I think on their front, they are doing all of that now. But the hesitancy is quite high up, especially now that everybody thinks that COVID is...
They either think it's... Some people never thought it existed. They thought it was a hoax. Some people think it's gone. And some think, well, even if it's still around, it's not affecting us. So why do I need to even go for this shot?
And there are people who also think that because they are vaccinated, everything is...
They're invincible.
They're invincible. So I think that getting a breakdown of the numbers would really have helped so that we know those who have still been... Because as a matter of fact, you can still contract it even if you are vaccinated. But just that the incidence of it crippling you, it being a critical case, is up to none. I mean, you get it, you may be asymptomatic, but if you test, you find that you have it. Yes, but
you could spread it.
The danger that it will not affect you. You are vaccinated, it won't affect you, but you could spread it to someone who is not vaccinated, and it will affect that person. So we don't have to get complacent. Even if you are vaccinated, if you want to go and take the booster shot, which I am considering, I haven't made up my mind yet. I'm considering.
At least you've got the first two. Or did you take the one shot or the two?
Johnson & Johnson.
Shot. So you had one shot.
I waited for one shot. I took my time.
You took your time.
I took my time.
At least you got
Especially with all the global supply issues associated with AstraZeneca. You know, that's what came here first.
Yes. And that's the one I took.
So people took the AstraZeneca many months after they were not getting the second shot. So I decided, no wahala, I'll just wait, bid my time, and wait for Johnson & Johnson to come. So that I'll take that shot, and eventually I came in and I got it, and I got most especially one of the other things which should encourage people is that these days you can't travel anywhere in the world without a COVID vaccination card.
You know, and if you do, I mean, for Ghana, if you're coming in and you're vaccinated, you don't have to go through all the testing
but they will still check your vaccination card.
They will check your vaccination card. So
it's just like yellow pox. Is it yellow pox? Yes.
Yellow fever.
Yellow fever. If you are traveling anywhere in the world, if you have not taken it, your yellow pox,
you need your yellow
fever card. If you have not taken it, you will not travel. So that's how COVID will be. The COVID vaccination card will become. So when you are traveling, they will check your COVID, and then they will check your yellow fever. So if not for anything at all, if you don't love your life, you are not afraid of COVID, but you have plans of traveling, at least
go and get
the COVID and make your life easier and get the COVID card tagged firmly somewhere in your passport somewhere, at least, so that if there is any opportunity for you to go outside the country or leave or whatever it is for some work or some business opportunity or some education opportunity or whatever it is, you won't be found wanting.
I think maybe it's time for us to start thinking that these surges are probably going to be seasonal. They're probably going to be related to weather changes. As we can see, the rains are setting in again. They bring along with them all kinds of health issues. We already know things like cholera and typhoid. We're going to be seeing those numbers rising. It looks as though this could also be one of those things where when there's certain weather conditions, you might see a bit more. As we said, and we read in the article, people are coughing and sneezing a lot more. You just think, oh, it's just a cold or it's just a cough, but there's a lot of things that it could be. So the protocols, washing hands, is one of the best ways to prevent the spread of disease and germs.
But for sanitizers, a lot of people have stopped spending money on it.
Yeah.
So I mean, and even the masks, you see a lot of it. Yeah, you see a lot of it in traffic these days. People are not buying the mask at all. So maybe with the surge and the people will go back to that, and especially with the sanitizers, the public places. There are still some banks where they are strictly. I think 2 days ago I was in one bank. They ensured that I had a mask on. They brought me one to put on before I got in there. So I mean, some of the banks are not letting their guys, and then of course the domestic airlines also as well.
You still
have to wear it. If you don't wear a mask, in fact, they will give you one. If you don't have one, right from check-in, if you don't have one, they will give you one before. So that's kudos to themselves and the banks. They're actually doing a good job. I don't know about the schools, especially for basic schools, where you would think that the best of care will be needed, because these are kids. I mean, of course, it's very uncomfortable for them to wear.
And we know how things spread among kids like wildfire.
So I think quickly, if there are some schools that are not doing, especially the public schools. I know for the high up, the private that are big schools. I mean, for those ones, there's no problem at all. The fees of one kid can buy box loads of marks for the whole school. So that's no problem. I'm talking about the schools, the MA schools, the RC, the DC, the DA schools, the MA schools, where nobody's actually giving them attention. That's why actually we need to turn our attention to ensure that we actually don't have a problem with that. This last week, Parliament MPs were concerned about why government was going to source additional 75 million euros for COVID response. It became a big issue on the floor of Parliament. Next Tuesday, the finance minister has to come to Parliament to account
for that,
for how much, for all the monies that Parliament has approved before they approve this additional 75 million euros. Maybe with the numbers going up, and with the fact that COVID is an opportunity for us to strengthen our health systems and our health sector, we may have to be looking at that. But that's no justification for government to borrow more anyway. We've taken a lot already. But the point needs to be made that the GHS is doing its best, at least from what I've said, my personal experience. I mean, going out of their way to send messages to people to come for booster shots. But they need to, I think, what they need to do, if they have not already done, is to take the polio approach. You know the polio approach? Go with from house to house.
That's it.
Go from house to house. And we've done it.
If Mohammed will not come to the mountain has to go to Mohammed.
I think they need to do it.
They need to. Or at least be located in strategic places. Go to corporations. Just check people.
Go to the churches.
They have to be a bit proactive, because let's not forget, these vaccines do expire.
Yes.
And the longer they sit on the shelf, the risk of that happening. And the cold storage chain is quite, I mean, that's quite intensive as well, cost-wise and all of that. So, all right, we'll take a quick break. When we come back, we'll chat more. There's some issues going on in town. Okay, Kweku David is out and about, and we'll see what he has to show us when we return.